Heart rhythm issues are challenging, they're scary. They don't make sense. They're not things that you can have control over. And I think because of that, they're difficult to deal with. We're a referral center, which means that patients who've had multiple treatments elsewhere that they may or may not have responded to, or may have developed new issues. We treat everyone sort of starting from scratch, starting from the beginning and making sure that we're thorough, that we understand the nature of the issue, that we understand the patient's needs and goals, and really craft a tailored treatment program that's very personalized and we think very effective because of our approach. Atrial fibrillation is a very common arrhythmia that is an irregular beating driven by the top chambers of the heart. And we care about this rhythm for two main reasons. One, it can increase the risk of having a stroke. And secondly, it can cause symptoms, anything from shortness of breath to palpitations to exercise intolerance to a general sense of not feeling well, or some combination of all of the above. Atrial fibrillation is definitely more common as we all get older, although it can run the spectrum of ages all the way from healthy athletes in their 20s and 30s, less commonly, up to patients who are in their 60s and 70s. Generally speaking, atrial fibrillation affects men more than women at younger ages, although as once we cross the age of 65 to 70, men and women tend to converge in the similar rates. Atrial fibrillation is experienced differently by every individual, and therefore our treatments are very tailored. Some people know exactly when they're in atrial fibrillation. They'll feel unwell, they'll feel their heart race, they'll feel short of breath, they won't feel themselves. Other patients, believe it or not, don't have any symptoms at all. And so we tailor all of those treatments based on that individual patient and how they're experiencing their arrhythmia. The actual condition itself is diagnosed by taking a picture of the heart's rhythm, either with a 12-lead electrocardiogram or, as more commonly in the mainstream now, wearable devices, smart watches, other applications that can record the heart's rhythm.